Super. So I'm going to talk about Ladies' Night at the Gun Range. Oh, there we go. Which the title in this photo, I'm guessing, is raising some questions. It's not so sunny, maybe. So first off, I have no idea who made that horrible poster. I did not. The second thing is that you may be wondering if they have alcohol at Ladies' Night at the gun club, and the answer is no, there's no alcohol. This picture was taken when I was getting ready to shoot guns with and speak to about 80 women about suicide prevention and why it's so important to lock up firearms when someone's at risk of suicide. And I can tell you, in this photo, I was wondering how the hell I had gotten there. So from Yale, I went to medical school, public health school, and I was so adorably eager, and I worked hard and I studied hard, and I was certain that if just science and all the smart people around me, we could solve the world's problems. And I got really interested in injury prevention and in suicide prevention. I, like probably everybody, like everyone in this room, had lost loved ones to suicide, and as an ER physician, I care for people with suicide risk every day, because a lot of people who are in crisis end up in the ER. And my colleagues and I want to help, but sometimes don't feel like we have that much to offer. So, somewhere along the course, I learned some facts that would really change the trajectory of my career. When we think about firearm violence in this country, I think mass shootings and accidental shootings of kids are what usually get the media attention. But actually, the majority of firearm deaths in the United States are caused by suicide. And I was really angry when I learned this because I hadn't learned it in medical school, so I was angry that I hadn't heard about this sooner. And angry that when we leave those deaths out of the national conversation about firearm violence, we are somehow implying that their lives less worth saving, that those lives didn't matter as much. So I also then learned from research that we can do something about it. So locking up firearms and other methods of suicide during times of risk can save lives. And that's something that, as an ER physician, I could counsel my patients on, and I could help their friends and families make changes to make the home safer. And actually, the cool thing is that you don't have to be an ER physician to do this, so you can talk to your friends and family and have the same impact. And the message is the same as having a designated driver. So if you drink too much tonight, hopefully you don't call the police to lock up your, if your friends don't call the police to get you locked up, but they just get you home safely, right? They get you through a tough time, and that's really what we're talking about. So we all know that a lot of us aren't sure if a friend is in trouble. Like, is it really okay to ask them if they're having thoughts of suicide? And the answer is yes. Science tells us that asking that question will trigger a suicide. And then in healthcare, I think even trained clinicians don't really know what to do with guns. Like, we don't know how to ask about that in a way that is respectful and not going to really piss off a patient. So I got interested in all of these questions. And so then in 2015, I had the opportunity to talk about them on a bigger stage, literally, in Denver at a TED Talk. That was the view of the audience. And it was really intimidating, but it also felt really academic still, like it was in my wheelhouse. I was prepared and I practiced, and it all went great. As that same summer, then I had another academic win when I published an editorial in JAMA calling for physicians to be more involved in firearm safety. And then because of that editorial, I got an email from this guy who is a physician and a self-described gun nut who became my firearms instructor, and together we created the Colorado Firearm Safety Coalition, which is a collaborative between gun shop owners and public health professionals working together to help prevent firearm suicide. And it's been great. We work in Colorado and nationally on ways to engage people in conversations, to educate firearm owners on how to look out for someone who might be at risk, and how to store guns more safely when someone is. I can't give you data yet to say that this is affecting suicide rates, but it is absolutely changing the nature of the field and really changing the kinds of conversations we can have, and really opening up new opportunities to reach audiences who need to hear these messages, like at Ladies' Night. So at these Ladies' Night events, women members of our coalition talk to the attendees about firearm safety in the context of suicide prevention, how to look out for people, that it's okay to ask if someone's having trouble. And I was terrified the first time because this wasn't academia, it was like a gun range in the Denver suburbs. And, but it was great. And the women were interested and they were friendly and they asked great questions and we had great conversations. And it made me realize shame on us in medicine and public health for not doing this sooner because nobody wants to lose a loved one to suicide. And so we all really need to start talking to each other, listening to each other, talking to our neighbors, understanding perspectives, and finding ways to work together. And I will end, and I'm ending, I promise, by saying that I'm still a physician and I'm still a scientist and I still believe in data. But I also think this work has by far been the most interesting part of my career. I still don't own a gun, and I won't ever, I don't think. And I still am horribly disturbed by the level of violence in this country and by the fact that I work closely with people who sell weapons for a living. But I'm also very hopeful that by working together, we really are finding a path forward. Thank you.